Bismillah Rahman Rahim. This is our lecture series on clinical anesthesia. This first video is on the classes of the drugs. Basically, we have these 8 classes. Number one is opioids. Then we have is phenothiazines, then benzodiazepines, then dissociative anesthesia, barbiturates, alpha beta, adrenergic, and then alpha beta blockers, and there is 8 category that involves different drugs that are not classified as such. Okay, what are opioids? First thing in this video, we are just going to see which drugs fall in each of these 8 categories. We are not going to discuss their mode of action or extra details in the video lecture number 1. The goal of our this first video is that you should remember that which drugs are opioids, which drugs are benzodiazepines, which drugs are barbiturates, which drugs are alpha beta blockers, like name. As far as naming or classification is concerned, we will just see that, and you should memorize this, and you should know when anyone talks about fentanyl, you should know it's opioid. Okay, butorphanol, you should know it's opioid. So we will just see that which drugs are included in which class in this video lecture. So in opioids, you have 3 categories. The first category is a full opioid agonist, and these full opioid agonists act on mu, kappa, and delta receptors. So they include morphine, oxymorphine, hydromorphine, fentanyl, methadone, hydrocodone, codeine, and oxycodone. Then there are partial opioid agonists that are buprenorphine and butorphanol. Then we have a synthetic one that is called as tramadol. And the antidote, therefore, opioids is naloxone or naltrexone. Okay, next we have our phenothiazines, which are also called as sedative and tranquilizers. And these are basically sedatives and tranquilizers. And you should know what is sedative, what is a tranquilizer, what is anesthesia. If you don't know, I have like next lecture of this series on these terms. So we will see that in there. So phenothiazines include acepromazine and chlorpromazine. Next we have is benzodiazepines. They include diazepam, midazolam, alprazolam. And the antidote for benzodiazepines is flumazenil. Next we have is dissociative anesthesia, and it includes ketamine and tilitamine. Next we have our barbiturates. They are divided into 3 categories: short acting, intermediate acting, and long acting. In short acting, we have thiopental and methoxytal. Then we have intermediate acting pentobarbital, and then we have is long acting, that is phenobarbital. And you should remember their antidote is nicotinamide. Next, we will talk about the others one. It includes propofol, etomidate, alfoxalone, chloral hydrate, magnesium sulfate, and chloralose. Basically, the last 3 are used rarely because they were used in previously they were used commonly, but now their use has been reduced, and the other drugs, other better anesthetic drugs, have taken their place. But we will see them too. Next we have is adrenergics. You should remember that in alpha beta adrenergics we have these alpha receptors and these beta receptors. And there are some drugs that are going to be non-selective, that they will act on alpha and beta as well. Even in the alpha group, we have drugs that will act only on alpha 1 and only on alpha 2. Meanwhile, in the beta, we have beta 1 receptor, beta 2, beta 3, and non selective beta receptor drugs. So, in alpha 1, we have our phenylephrine. In alpha 2, xylazine, ditomidine, miditomidine, and dexmedetomidine. In beta, we have beta 1 dobutamine, beta 2 clenbuterol, albuterol, that is also called as salbutamol, and number 3 terbutaline. Here in non-selective, we have isoproterenol, that is also called as isoprenaline, and in the beta 3, we don't have any as such drug acting. Then we have our non-selective. In non-selective, we include catecholamines. Catecholamines are basically four: epinephrine, norepinephrine, dopamine, and again butamine. That is also we have mentioned over here. And you should remember this thing that epinephrine, non-epinephrine, and dopamine are natural. They are also made by endogenously by our own bodies, animal bodies. But the butamine is a synthetic one, lab-made drug. And how they act? Epinephrine act on alpha 1, beta 1, and beta 2, and it has very little activity on alpha 1. Norepinephrine mainly acts on alpha 1, beta 1, but it has a very little activity on beta 2. Dopamine acts mainly on dopaminergic receptors D1 and D2. But if you will increase the dose of dopamine, it will also start to act on beta 1, beta 2, and alpha 2. Same for dobutamine, it acts on beta 1 mainly, but as you will increase the dose, it will act on beta 2 and alpha 1. So, uh, you should know the names. You should know which drug acts on which receptor. That is very important, and that is first thing as a clinician that you should know. The second thing you should know is what are the functions or where are these receptors found and what will they do if these receptors are stimulated by any drug. So, as far as alpha 1 is concerned, alpha 1 is present on arteries of all the organs, and what action it will produce? It will cause vasoconstriction of all those arteries. So, if the arteries will be vasoconstricted, the blood flow and total peripheral resistance will be increased. So it has a bit of a role in increasing the heart rate, blood flow, increasing blood flow in this. Next, we have alpha 2. Alpha 2 is present on veins and it will cause venodilation. So, whenever you will see xylazine or ditomidine is being injected into an animal, you will see heart rate will go down, cardiac output will go down, respiratory rate will go down, and you will have a generalized hypotension in the body. When we will talk about beta 1, beta 1 receptors are specifically called as cardiac receptors. They are present on heart. They are also present on kidneys, and their main action and very prominent action is increasing the heart rate, stroke volume, cardiac output. So you will see, so if you have any patient that is having like bradycardia and his heart contractions and heart strength is going down, so you will inject beta 1 and its heart rate will start to increase. Then we have is beta 2. Beta 2, it is present on arteries and it will cause vasodilation. Again, the blood flow and all those things will go down. Beta 3 is present on adipose tissue, and that's why this drug, like, don't have as such a clinical role right now. Next, one more important thing over here is this. Um, for PI, it stands for positive inotrope. What is a positive inotrope? Positive inotrope is anything that will increase the heart rate. It will increase the contractilities. So, uh, and then we have VC. VC is vasoconstriction. So, you should remember these properties of these drug too, that alpha 1 is also called as positive inotrope, like you see increasing blood flow and heart rate. Epinephrine is also a positive inotrope and also a vasoconstriction because it causes a constriction of blood vessels that will cause the increase in the heart rate. Then norepinephrine is only vasoconstrictive, but it is not as good positive inotrope as epinephrine. So we will write or consider it as vasoconstrictive only. Dopamine and dobutamine are positive inotropes. Okay? And further, when we will see like the drugs that will that act on the cardiac system, CVS, we will see these inotropes in a better way over there, because there are not only inotropes, there are chromotropes, there are dromotropes. So what are these types of drug? We will see their detail when we will specifically study inshallah the drugs of cardiac system. But right now, because we are here, we are also seeing these drugs that are acting on the heart and blood vessels, so it's important to know even over here for remembrance that so these are which one are positive inotropes and which one are vasoconstrictives. Next we have is alpha beta blockers. Um, like you see in this slide that these drugs are alpha beta agonists, like they stimulate the action of alpha and beta receptors. When you see the alpha beta blockers, these blocker drugs, what we they will do, they will basically block the action of these receptors. So you can say, as an alternatively, you can say that these drugs are basically the antidotes of all these drugs. So, in the alpha blockers, we have alpha 1 as prazosin. Alpha 2, we have yohimbine, atipimazole, and tolazoline. Yohimbine is specifically used as an antidote of xylazine. Atipimazole and tolazoline are specifically used as antidotes for this ditomidine or miditomidine. Then we have a non-selective alpha blocker 2 that will block alpha 1 and alpha 2 both. They include phentolamine and phenoxybenzomine. Then we have beta 1, atenolol, metoprolol. Beta 2 blockers have no clinical use. And then we have non-selective beta blockers, that is pindolol and sotalol and propranolol. So up till now we have seen the alpha beta blockers and drugs. Next we have another category that are cholinergic drugs. These are not that much important, in clinical these do have very important function, but up till now we have talked about majorly used drugs. In cholinergic drugs, we have parasympathomimetic, also called as cholinergic or cholinomimetics or parasympatholytics. You can say that parasympatholytics are antidotes or for like parasympathomimetics. In this, we have further categories. We have direct acting or indirect acting and parasympathomimetic antagonists हैं ये, और then we have nicotine antagonists. First, in direct acting, we have acetylcholine, that is an endogenous molecule, endogenous neurotransmitter too. But in clinical setting, we don't use as such acetylcholine. Uh, then we have methacholine, carbachol, bithanacol, and pilocarpine. These are other drugs of this class. In indirect acting, we have two classes, carbamates and organophosphates. If carbamates will act, they can be reversed, but if organophosphate compounds are injected in the body or they have been given orally, if they will bind on these receptors, they will be irreversible. So in carbamates we have physostigmine, neostigmine, adrophonium, and these basically are used as insecticide and all those agents. And animal normally ingest these drugs and have their toxicity. So we majorly study these organophosphate compounds, etc., in the toxicology. Then in parasympatholytics, we have atropine, glycopyrrolate. These two drugs are mainly used. Then we have scopolamine, and in nicotine antagonist, we have hexamethonium and trimethophan. So up till now, we have just talked about which drugs are included in which drug classes, and you should know all these drug classes because these are important. Number first thing of studying pharma or anesthesia or like drugs is that you should know the drug class. You should if anyone is speaking about any drug, you should know what class it is belong and what does it act. So this lecture was all about no concepts, just remembrance. So that was all. Stay tuned for the next lecture for more knowledge. Thank you so much.